So hey, we're in part two of the employee journey. Very excited about this because now we'll start really getting into what we feel are key takeaways, right?
Yes.
What are the things that you can be helping your employees understand this journey and this horrific journey called healthcare or getting healthcare services? Like you said, both of us have had some, some care this year. And I got to tell you, getting my colonoscopy scheduled was a absolute nightmare.
Yeah.
The surgical center that did it, the physician, the gastroenterologist that did it, oh my God, they were wonderful. But it was getting the referral from my primary care physician, who's part of a health system, to an organization that's part of another health system.
Right.
That took 6 months.
So I know we talked about it last week too. An app can help, but if the app is still dealing with that same delay in communication, it's not simple. But it's, a lot of people would give up after that process. 6 months, no way, I'm not doing that. I mean, I'm working on it right now, trying to get records from one specialist to the other so that they know what's going on. And it's not good for me to share what I kind of remember from that visit. Like, I wish I had the actual record, because I'm like, well, this is what I kind of remember. Well, what about this? I'm like, I don't know what you even asked me. I don't understand. I don't speak that. But those types of things I think are still going to be an issue because of capacity of healthcare and just some of the communication. But
and I cannot, step one of this is you got to have a good relationship with your primary care.
Yes. Absolutely.
I look at him as my healthcare accountability coach, right?
Yes.
That he is there to make sure that he's breaking down the barriers of the unknown. Okay, well, what does a colonoscopy look like? What do I have to do? And some anxiety around that, which was, by the way, it's no big deal. So anyone that's hesitant about it, please go do it. But he is my accountability coach. He's there to make sure, okay, Chris, every year we're going to look at your blood work. We're going to look at, you're at 52 now. What are the things that you need to be doing between 52 and 55?
Yep.
And he's there to keep me accountable for my own health. And that I cannot overstate. You must have a good relationship with your primary care physician. To me, it all starts there.
Well, and I will say in our community, I'm now, I think in the last 10 years, I'm on my 5th primary care doctor, because mergers, acquisitions, or buy-ups, or retirements, or whatever might be the case. So that, I think, is still a challenge for families. It's not easy to get that started, but investigate it and get that done. Call your HR department or talk with your insurance carrier that's there about who's available that I can get scheduled, because I think that's important that you start that process. A couple of our clients and some of the top performing programs are putting in place direct primary care for their employees. So here's an employer sponsored clinic, and employees and families, you have unlimited access to this clinic that's open all this time. That doctor spends a lot of time with you, gets to know you, and you know that that's going to be open because it's in conjunction with the employer. And then that doctor has the right information to get you to the next location, because it's all built into their program. That's not going to be a case for every single employer. We don't even have that yet necessarily on our plan. But I think that's an area that it's focused on primary care relationship, and then that referral correctly to the right location for the colonoscopy or whatever might be the case.
Yeah. So I've been in Davenport 10 years. And for the first 8, I was in the same boat as you. I could not find a primary care physician that didn't have their hand on the doorknob the entire time they were talking to me.
Yeah. And that's reality for those docs. It's crazy.
I'm like, okay, so we're not going to have a relationship.
Yeah.
And, again, I don't have to like you. I'm not going to take you out to lunch or for dinner, but I do want to know you actually care, and that you're going to sit down, listen to, hey, here are some concerns I've had in the last year. Is this something that I should be concerned about or not? And if I am concerned, what's the next step of that?
Yep, absolutely. That should be the initial, like you said, the starting spot for your healthcare journey is that primary care doc. Yeah,
yes. I was literally months away from paying for myself a direct primary care physician
just to
have it, because I couldn't find one. And luckily, a good friend of mine who's a cardiologist referred this younger primary care physician that just
awesome.
came in, and he was accepting patients, and he's just a great guy. So yeah, it all starts there. So what's next? All right, you've got a good relationship with your primary care physician.
Yep.
What's the step 2 of this journey?
It should have been the topic we all talked about before COVID, but it is extremely important now, is to have your wellness checks and anything that is covered under wellness, annual physical, colonoscopies, your PSA exam,
Yes,
mammograms, pap smears, the things, your child well checks, those things that are covered by the health plan, please get those done. I can't tell you, you and I both know within our clients, we've had significantly high claims and families that have gone through horrible health treatment conditions because something didn't get corrected or checked during COVID.
So the last,
their family, and it's impacting certainly the cost of care.
so the last article I read about colon cancers, we will see a 40% increase in colon cancer in the next 2 years because so many people couldn't get their scheduled colonoscopies. I was one of those. I could not get it in 2020. I was lazy in 2021. Can't blame anyone other than myself. But okay, what if I would have had a stage 1 colon cancer in 2019? You know, I turned 50 in 2020. What would it have been this week?
Yeah. So if you do nothing else with your health plan, find your primary care doc, or at least get that visit started, and then ask to do your wellness. I mean, those are 2 things that are either minimal cost for the primary care visit, and then should be covered if your plan is abiding by all the ACA provisions, that those things are covered. And that is a big step forward for you to be healthy and to not spend more money out of your pocket, because it's minimal cost. And then again, it helps the health plan stay healthier.
Yeah. So, and
yeah, go ahead.
Just real quick, when it comes to preventative, just to help educate, you know, ask your physician, is this a preventative procedure or is it a diagnostic procedure? So if you've had something in the past, let's say it is a colonoscopy, they've had something in the past, now they're going in for their second one or third one or whatever, potentially that could be considered diagnostic, and it will flow through your deductible and coinsurance.
And if you're not, you know, old enough to be eligible for that.
Oh, geez.
Anyway, I'm sorry. That was a big thing. My birthday month, man. We got to have some fun with it. But I would say the other thing too is, after you've had primary care, you've done your wellness, is understand what it actually means when you go to access care.
Yes.
And a lot of that is talking about the emergency room that is open all the time. You and I have talked about this with our clients, that when we drive in our geographic footprint for our clients, there are advertisements on billboards for waiting times at the emergency room.
Yes.
And everybody thinks it's open, I'm going to go. And even before COVID, but certainly that's where everybody went. And you've got all the sick people with things that aren't really an emergency. They're going to sit there and wait much longer. And not only is it going to cost you significantly more, but you're also bogging down that specialty care that's there to prevent heart attack, death, and to deal with traumatic car wrecks and those things. And it's just not a place to be unless you are truly life threatened. Don't go there.
We were at a client, a month ago, and we went through a report. So we get reports, obviously it's all de-identified, it doesn't show names, but that client in that quarter had 26 ER visits and 20 of them were non-emergent.
Yeah. And what we found with that was that it's a very rural client. And so the only healthcare in a lot of those communities was the hospital with an emergency room. So our next step into that conversation is telemedicine. Most health plans have that built in, where you can virtual visit with a doctor, get diagnosed, prescribed, not have to make that trip. But again, you've got to think about it. You've got to have the app on your phone ready to go. You've got to have the phone number saved. But if you as an employee in your family, work with your primary care as best you can, get your wellness, and then know that start with virtual visit, maybe urgent care from there, but do your best to stay out of the emergency room. You're going to have a much better health journey, and it's going to keep you from spending a crazy amount of money and keep you healthier.
Talked to a friend last week. He was having some pain. He went to the ER. He sat there 6 hours.
Yeah.
He just left.
Yeah. That's the reason. Just take 10 minutes and use your virtual visit and see what they say it might be, and then work from there. But
yes, nobody wants to go to the ER. And just to reinstate, you said it best, know your options before you're in that situation, because when you're in the situation, I think our brains have been programmed, go to the ER.
Yep, because that's what's open. So,
right.
Now, good conversation, CB. Hopefully that's been helpful for employees and their families.
Yes, well done, and thank you all.
Thanks.